And nurses are in crisis due to the perfect storm of the pandemic, staffing shortages, and burnout. Now, as the backbone of our healthcare system, the repercussions of the nursing shortage could negatively impact the care, or lack thereof, provided to communities across the nation. According to one survey of 10,000 nurses published by NurseGrid last September, 92% of nurses are worried about the shortage. 4 out of 10 nurses plan to leave the field by the end of this year. Here to provide insight on exactly what nurses are going through is Wendy Garvin. She's a nurse practitioner and founder of the Nurse Wellness Mentorship. Welcome to the program, Wendy. How would you describe the current mental state of nurses?
Yes, nurses are not doing well. Nurses are stressed, burnt out, and the shortage is just adding to that. So, as you know, the nursing shortage and stress and burnout, it's not new for nursing, right? So last year when the pandemic hit, we didn't have the capacity or reserves to deal with that. So it just really increased the nursing shortage and amplified the stress and burnout that we are experiencing at the bedside.
Now, there is a situation in which there are the traveling nurses who can make more than the resident nurses, who get the salary position. Is that adding to the stress?
Well, it is adding to the stress. What's happening, in clinical practice is a lot of horizontal violence is happening because of that, right? So a nurse who works for an institution is being paid base salary, and then you have a travel nurse who comes in who's making 3 or 5 times more than that nurse. So there's an animosity that can happen there for nurses who are hired by the institution opposed to nurses who are coming as travelers to help. So it's really creating tension among nurses.
And what is the situation then when it comes to vaccine mandates? Is that impacting how many nurses are even showing up for the hospital?
Yes, so vaccine mandates is another factor that's adding to the nursing shortage and stress because, just like the public, many nurses are not comfortable, right? They feel like they don't have enough information to make a decision if they want a vaccine or not. And it's being mandated that they have the vaccine or they lose their job. So threatening a nurse to lose her job, his or her job, that's messing with their livelihood. We went to school for a very long time. Nursing school is not easy. So for anyone to say that it's mandated you do something or else, you'll lose your job, that adds another layer of stress that, nurses really don't need.
Part of the challenge, right, is that people in the healthcare profession ostensibly have a better understanding and access to the science that's available about the coronavirus. So why is that such a problem in the nursing community right now?
Well, nurses are people, and people have their own beliefs about vaccines, whether it's vaccinating themselves or their children. And it's a personal decision. I'm an advocate of vaccines personally, but everyone, has their own beliefs and should be able to make their own choice. And in terms of nurses and vaccine mandates, these are nurses who have been in the field even since last year, right? So they have been putting their lives on the line, really impacting their family, their kids, their husbands have been at risk for, COVID-19. But now, a year later, being threatened to lose, you won't agree to get a vaccine. I don't know about that. And many nurses have expressed
Wendy, I
about that.
think we're having a little bit of trouble with your audio, but I do hear what you're saying, which is that nurses already under stress 1 year later in the same situation are really hard pressed to find a way forward. And so thank you for what you do, folks. Wendy Garvin is a nurse practitioner and founder of the Nurse Wellness Mentorship. Thanks again for joining us.